Hello, everyone. Hello. Welcome to the first of our presentations on understanding chronic diseases. My name is Desmond Croker, and I am a registered nurse, diabetes educator, and nurse educator. Tonight, we will start by, our first presentation will be on pre-diabetes. We know that there are a lot of people out there who have pre-diabetes, and the doctor says to you that you have pre-diabetes, you have a little touch of sugar, and all kinds of things. And a lot of times they make it seem as if it's okay. It's okay. You don't need to worry. So let's talk about pre-diabetes and what it really is and what you should do about it. I'm now going so that you can see a presentation that I would have prepared for this. All right, it's coming up there. Okay, it's coming up here. All right, here we go. I'm trying to get it to, all right. So what is pre-diabetes? All right. Generally, sugar levels in the blood are higher than normal, but not high enough to be called diabetes. So, person is considered to be having in a state of pre-diabetes when the blood sugar is not within normal levels. However, that blood sugar is not high enough to be diagnosed. It stems from insulin resistance, where the body is trying to break down the sugar, but is not able to do so because there's fat preventing insulin from transferring sugar into the cells. So we have resistance. There is increased sugar remaining in our bloodstream. This condition basically is saying that you are on your way to diabetes, right? If you don't put things in place, you're on your way to diabetes. Let's look a little bit at what's happening in terms of diabetes in our region. First of all, 1 in 8 adults in North America and the Caribbean, according to the International Diabetes Federation, have diabetes. 1 in 6, even more people, they don't have diabetes yet, but they're on their way to diabetes. And 1 in 3 persons have diabetes and don't even know that they have diabetes. So why all this hullabaloo about diabetes, about pre-diabetes? So why make all this fuss about the pre-diabetes? A pictorial view of the natural history of diabetes. It starts with impaired glucose tolerance, or as we're discussing tonight, it starts with rises a little over where it should be. So this is the first column here. Impaired glucose tolerance, and this can go on for years. But then after a while, you would move over to diabetes. However, for a period of time, you won't even know that you have diabetes. That period is called undiagnosed diabetes, and that can last for between 5 to 10 years. So people can have diabetes for 5 to 10 years and don't even know it. And then there's other section, the last column. So what's the sense in all of this? If we look to the bottom of the screen, you see 1 in black and 1 in red. The 1 in black says microvascular complications. And if you notice where that starts from, a little before the period of undiagnosed diabetes. So we're having some microvascular complications before before you even have diabetes. But look at the red one, the macrovascular complications. That starts way before, all right? So while you're thinking that, oh, I don't have diabetes, I just have a touch of sugar. When you're thinking that I only have a little bit of sugar, some big problems are happening in your system while you are just being relaxed and carefree about it. Now, these are 2 fancy words, microvascular and macrovascular. What do they mean? Let's look a little bit at what they mean. Microvascular complications. Retinopathy. Hello? Welcome to the first of our presentations on understanding chronic diseases. I think my name is Desmond, and I am a registered nurse, diabetes educator, and nurse educator. Presentation. Tonight we will start by our first presentation will All right, sorry about that. I was getting a playback there. All right, let's get back to all right, let me start back sharing screen. All right, so we were talking about microvascular complications. And so what we're saying, one of the things, what microvascular complications mean is that the organ, small blood vessels, the veins and arteries, the small veins and arteries, they start to get damaged. The first one is your eyes. That condition is called retinopathy. So the blood vessels in our eyes start to get damaged, and it continues until, if it's not treated, until you eventually get blind. The next one is your kidneys, right? The kidneys have some small blood vessels that can be damaged as a result of diabetes, and that is called nephropathy. And so when the kidneys are not functioning, you're not able to pass urine, you're not able to pass out the waste from your body. And the third microvascular complication would be damage to the nerves, especially in the feet, all right, neuropathy. And so you start complaining of burning and tingling sensation in your feet. And that burning and tingling sensation would eventually lead to numbness, where you can't even feel anything in your feet. These complications, I'm saying, start to occur before you even have diabetes. Then there's the macrovascular complications. These, we said, start long before, way into your experience of having pre-diabetes. And what are they? Now, the macrovascular complications, they occur as a result of a condition known as atherosclerosis occurring. What is that? The walls of your blood vessels, they start to build up with something we call plaque. And because there is a limit in terms of the space in the walls of your blood vessels, and this plaque is taking up some space, there's narrowing of the walls of those blood vessels. And so blood is hindered. Blood is not able to move through the blood vessels as freely as it should. What can happen as a result of that? We have heart diseases. We have heart attack occurring, heart failure. You have, and so we're saying a lot of times people would normally live in their life, and just realize that all of a sudden they get this severe chest pain, they get a heart attack, and only after the heart attack they realize that they have diabetes. This is the reason why. All right. Another one, stroke, is another one of the macrovascular complications. Again, similar to, as I said before, people can just develop a stroke just like that. And after the stroke, that is when they realize that they have diabetes. But they've had it all the while. It's just that this is what would have brought it on. So we're saying that these complications occur long before you have diabetes. So you want to ensure that as long as you recognize prediabetes, you want to put things in place early to prevent the onset of diabetes. Now, let's talk about who is at risk. If you have a family history of diabetes, you are at risk for prediabetes and diabetes. So if your mother, father, brother, or sister had diabetes, you are at risk. Ethnicity, if you fall into any of these ethnic groups, all right, African, Asians, Middle Eastern, or Hispanic, you are at risk for diabetes. Then age is another risk factor. If you are 40 years or over, that puts you at risk for diabetes. All right. So far, there's nothing we can do about these risk factors. All right. Then women that give birth to a child 9 pounds or over, both the mother and the child is at risk. So those nice big babies, they're not nice, they're sweet. So you want to avoid those situations where you're having these big babies. Women that have gestational diabetes are also at risk for prediabetes and diabetes. Gestational diabetes is diabetes only during pregnancy. So you want to, women that would have had gestational diabetes, you need to listen to what we're talking about here tonight so that you can also delay or avoid the onset of diabetes. People who are inactive, exercising less than 3 times a week, you are at risk for prediabetes and diabetes. People who are obese and overweight, you are at risk as well. Now, we talked about insulin resistance earlier, and these are some things that predispose you to insulin resistance. We said that insulin resistance is how the whole prediabetes starts. All right. So women with polycystic ovaries are at risk for insulin resistance, and so we need to watch that. Acanthosis nigricans, for those of you who might not have heard this term before, you will see what it is like. I'm sure that is something that you would have seen before, but acanthosis nigricans is an indication of insulin resistance. And then there's metabolic syndrome. Metabolic syndrome is a combination of a number of conditions occurring at the same time in the body. Now, these are the things that make up metabolic syndrome. And if you have metabolic syndrome, again, you are at risk for insulin resistance, which would lead to prediabetes. If your triglycerides are higher than normal, if your good cholesterol, the HDL, is lower than normal, if your blood pressure is high, if your waist circumference is big, for women, if it's more than 35 inches, and men, if it's more than 40 inches. This combination is what makes up metabolic syndrome. And metabolic syndrome puts you at risk for insulin resistance. So look at this picture. This dark area that you're seeing behind this person's neck is what we call acanthosis nigricans. This is not a sign that the person did not scrub their neck properly when they bathed. You can scrub that how much you want and it will not go away. It's a sign that the body is struggling to deal with sugar. And so it's something that you need to take in hand right away. So how can we know if we have prediabetes, diabetes, or normal? The only way to know is by doing the blood tests, all right? And these are some blood tests that will indicate to us. Now you can have your I should tell you that there are no, usually there are no symptoms. Most of the times people don't feel anyway sick or anything new. Or they may feel these things and just consider it as part of growing older. All right. And so a lot of times the symptoms are either ignored or the symptoms are not felt. So we need to do a blood test. As long as you would have recognized that you fall on the 2 or 3 of those at-risk category, you want to ensure that you monitor yourself. So the blood test that can be taken is what is known as a fasting blood sugar. The fasting blood sugar is taken when after you would have had your last meal. It's taken early in the morning. You have your last meal at least 8 hours or not more than 12 hours before your breakfast. All right, your last meal should be not less than 8 hours and not more than 4 hours, not more than 12 hours before your breakfast. No. That blood sugar test, if it's between 100 and 125, that is an indication of pre-diabetes. Now, I don't want you to go about diagnosing yourself. So if you recognize this, it's not for you to tell yourself, oh, I have pre-diabetes now. It's for you to go see the doctor with these results. The doctor may want to do their own test and they make the decision as to whether or not you have pre-diabetes. Then there's a glucose tolerance test where the doctor may send you to the lab where you do a fasting blood sugar. You fast the night before and you come early in the morning, do the test, and then you wait. After you take off the first sample, they will give you something sweet. And then you wait for 2 hours and then they will take another sample. All right. Now that result, if it falls between 140 and 199, is an indication of pre-diabetes. And then there's A1C. Before I go to the A1C, if you check your blood sugar randomly 2 hours after any meal and it falls within this number, 140 to 199, again, that is an indication of pre-diabetes. Then there's A1C. The A1C is a blood test that is done to give an average of what your blood sugar is like between for the past 3 months. So the A1C, if the result comes back with between 5.7 and 6.4%, that again is an indication of pre-diabetes. So those are things that will tell that you have pre-diabetes. So what are the recommendations? You want to focus on some lifestyle modification to help to prevent or delay the onset of diabetes. All right, so you want to focus on your diet and may have some restrictions there. You want to focus on doing some exercise, starting some exercises that will help to get the body in fit and in shape to deal with the sugar in the body. You want to work on losing some weight if you're overweight or obese. You want to work on losing some weight. It is recommended that you lose between 5 to 10% of the weight that you presently have. Whatever your weight is presently, work on the first goal being 5 to 10% of that weight. And just that alone can significantly delay or prevent the onset of diabetes. Then there's some medication. Sometimes the doctor may prescribe a medication for you. Most of the time it's metformin. Again, that would help in removing some of the fat from the cells that prevents the insulin from attaching to the cells to allow sugar to get into the cells to make energy. And so sometimes medication can be used, but your lifestyle modification alone can do a great job in preventing the diabetes. You want to do annual screening. If you know that you have diabetes, pre-diabetes, sorry, if you know that you have pre-diabetes, there's some screening that you want to ensure that you do every year to ensure that there is no damage to your body. So you want to do your eye screening. You want to check your blood sugar regularly, right? You want to do your annual eye screening. You want to check your feet regularly. All right. Well, in all, I should say that you should go check your doctor for that screening, the checkup, at least once a year to ensure that you are still on the right track. Or actually, the aim should be to reverse this prediabetes. All right. Now, some important things for you to note with regard to the lifestyle modifications that you need to make in order to treat diabetes. The first one is that these modifications, for you to start these modifications, it starts with a choice. You have to decide in your head, you have to decide in your mind, make that decision that you will do what it takes. It won't be easy eating less food than you would normally eat. It won't be easy eating with less sugar than you normally would, but you would have to make that decision. So once you have made that decision, you will do it. It won't be easy to have to get up in the morning to go and exercise, but once you make that decision to do what it takes, you will do it. So it starts with a choice. Secondly, there is no one size fits all. So what that means is that I should, if I'm going to help you with, if I'm going to really help you to manage your diabetes, I can't just give you a piece of paper with some writing on it and expect that that is going to fix it. All right? Because it is about understanding where you are with your management. It's understanding what's going on in your specific, unique situation and help you to navigate your way out of it. All right, so everybody has their own unique circumstances, and so it is a one-on-one, it's a self-management approach. The third thing you need to pay attention to is that it takes time. So again, it won't work if you just decide that, well, oh, I go to the doctor, take some medication, and expect that in 2 weeks' time, everything fixes. No, it takes time. It won't work if you think that, oh, I'm going to go and exercise for 1 month and it should fix. No, these lifestyle habits were things that you were doing all your life. And so it would take some time for you to get accustomed to making those changes that are necessary. So don't beat up yourself. Be patient and take time and get over it. The next point is that it takes mentorship and support. Now, a lot of people want to start an exercise program. A lot of times people want to watch their diet, look at what they eat, but then they don't know where to start. That is where mentorship comes in. And mentorship is not only about telling you what to do, but it's about working with you, going with you step by step through the process of managing this prediabetes. Support is also important. So it's important for you to have people around you in your home or friends that will support you in this journey towards reversing prediabetes. So the more support you have, the greater your chance of being successful in this. They will hold you accountable for the goal that you would have set for yourself. The next point is that it is a package, not isolation. So to say that you're going to just work on your diet alone and don't bother with this exercise thing, all right? You're going to do exercise alone. It will not work. It is a package. You need to be able to get all the components in. And that is what the mentorship is for, to help you to slowly but surely get the entire package down. There's some supplements that can be recommended for persons who are so inclined to help you with it. Again, the supplements will not prevent, will not make it, will not cure it, but it's the supplements along with these lifestyle changes. The last thing I want to mention in terms of importance to note is that there are no guarantees. What do I mean by that? Now, having pre-diabetes and changing your lifestyle does not mean that you will not get diabetes. So having pre-diabetes and making changes to your lifestyle, doing all that we talk about tonight, will not guarantee that you will not have diabetes. However, it will delay the onset of diabetes, or it can also prevent you from getting diabetes. So if, however, you do get diabetes, you will have already started on your way to managing this diabetes. So this won't be something new to you. And so you would have already had a head start in terms of your diabetes management. So that is where the plus is. All right. I want to thank you all for listening to this, our first presentation on understanding chronic diseases. I want to encourage you to make contact with us if you have any challenge, if you have any questions. All right, these are our contact information. The name of our company is Annie's Memorial Chronic Disease Education Center. And there's our website, our WhatsApp numbers, Facebook, and LinkedIn pages, as well as our YouTube channel. A recording of this presentation will be saved on Facebook and YouTube, where you can, for persons who would have missed it, you can go back and have a look at it and ensure that you are ready and here for our next presentation, which will be on the 23rd of September. So look out for the link, look out for the flyer as we continue to raise awareness on chronic diseases and give you the tools that you need to help in managing chronic diseases. Have a good night and thank you for sharing with us.